Hey guys, Dr. Baird here. Today we're talking about 3 tips to solving knee pain to keep you active, strong, doing what you love, even when nothing else has worked. So, knee pain is one of the more common things that we see here in the clinic, and it's one of the more common things that keeps people from being as active as they would like. And one of the big problems that a lot of people have is causes frustration and confusion as they go and get their traditional therapies like, again, chiropractic, massage, physical therapy, and the general pattern is that it feels good while you're going through the treatment, but then in a matter of months, a matter of weeks, and some people it's even days later, once you kind of stop the treatment, the pain comes back. And so today we're going to talk about 3 things you can do to actually solve knee pain and keep it from coming back, which is the ultimate goal. So to do that, you first have to recognize the 3 root causes of knee pain that are, again, most commonly overlooked in traditional medicine. So that goes back to 1, how we move. So another term for that is called movement patterning. Then getting into how much movement we actually have. So that's kind of, again, mobility is a term for that. And then how well we can control that movement. And that goes back into strength. So again, the 3 things are movement patterning, mobility, and strength. And when it comes to the knee, these are 3 things you can do for the knee to improve that movement to, again, finally solve knee pain. So very first thing when we get to movement patterning and knee pain is learning how to unlock at the hips anytime you're going into bending forward or sitting down. So what that looks like and what I mean by unlocking at the hips is that if we're going to sit down, a lot of people with knee pain, their first movement is to unlock at the knees, which looks like this is unlocking at the knees, which again, if we have knee pain, is going to cause a lot of pull, a lot of tension over the front of the knees there. It just puts an increased load at the knees, which contributes to knee pain. So what we need to learn how to do is unlock at the hips. So if I'm going to sit down, that first movement needs to be unlocking at the hips. Then it's okay to bend at the knees. But again, it keeps that center of gravity where it should be to prevent continually irritating that knee. Next, we're talking about mobility. So another thing that people with knee pain lack a lot of the time is they have very stiff ankles. And if you have stiff ankles, really you're just not able to absorb the ground forces very well, which again is just going to be more impact at the knee with each step that you take. And over time, that's going to contribute to knee pain. So you're going to want to look at your ankles and see how much range of motion you have there. The other one, again, probably the most important, really goes back into strength. So especially at the knee, your hip strength is really what controls a lot of movement at the knee. So if standing up, I don't have adequate hip strength, what's going to happen is my knee is going to kind of come in forward here. And again, over time, that's going to be contributing to knee pain. So you really have to focus on building strength at your hips. So there you have it. Those are 3 things to, again, overcome knee pain, keep you active, keep you strong, doing what you love, even when nothing else has worked. Thanks for watching.